so much for joining us here on the Allsorts podcast.
Thanks for having us.
Great to be here.
I was saying, like, right before we hit record, I feel as a GI dietitian that celiac disease sometimes gets a little bit forgotten about in the fray of IBS and SIBO and all those sort of like very trendy topics. And I'm really excited to do this deep dive with you and for myself to learn as well, because it's been a few years since I've done a deep dive on my own into the research and learn what is new and great in celiac disease research, also what you're doing at the Celiac Disease Foundation. But I think before we get into all of that, maybe we want to just bring it, especially if someone is listening to this and they're like, I just got newly diagnosed. I'm feeling a little scattered, a little overwhelmed. I don't feel like I've got a handle on what's going on. Maybe we can start by just defining what celiac disease is. In particular, too, because I think there's a little bit of confusion around this. What is the difference between it being an autoimmune disease versus a food intolerance or an allergy?
Absolutely. Happy to talk about that. So celiac disease and food allergies are both conditions that involve adverse reactions to certain foods. But where they differ is in their underlying mechanisms, the symptoms that occur, and really how you manage them on a daily basis. So celiac disease is a genetic autoimmune disorder. So it affects families where the ingestion of gluten, which is a protein in wheat, rye, and barley, leads to an immune response that attacks the small intestine. And so, as you know, in our intestines, we have these small finger-like villi, and their job is to pull in the nutrients every time we eat food. With celiac disease, when you eat gluten, it causes damage to those villi, and it can lead to many different complications, nutritional deficiencies, bone density issues, fertility issues. Any system of the body can be affected. With a food allergy, it involves more of an immediate immune system reaction to a specific food protein. So it's mediated by the immunoglobulin E antibodies, and it can lead to life-threatening symptoms of anaphylaxis. And so the allergy is more of an immediate response where you might need an EpiPen or Benadryl or steroids to treat it.
Yeah, thank you for that. And I'm wondering, for anyone listening to this who is maybe curious if they have celiac disease, because it isn't that sort of immediate feedback response, like an anaphylactic reaction, what do those symptoms, what are the most common symptoms that we're seeing? But also, what does that feel like in the body? What are some of the signs that maybe I should be talking to my doctor right now?
So there's actually over 200 signs and symptoms of celiac disease, which a lot of people don't know. And I think that makes it really difficult to figure out what's going on. So they can be, we call them classical symptoms, like your typical digestive symptoms, like maybe diarrhea or vomiting or any type of bowel movement pattern change. To be honest, we can have constipation as well, abdominal pain. Those are what we call classic symptoms, but we're seeing more and more that people are presenting with other things like neurological things like neuropathy, headaches, migraines, brain fog is a really common one. Some people, the only sign is that they have anemia or a bone mineral density issue that's unexplained. Some people have fertility issues. So really the list goes on and on. It can affect nearly every system of the body.
And what I think is so interesting about it is that, so as I mentioned, celiac is a genetic disease, and so it's passed on through families. But the same people within a family may have completely different symptoms. So I was diagnosed with celiac disease 20 years ago this week. So it's my 20th anniversary of having celiac. My mom also has celiac, as does my 10-year-old son. My mom's symptoms of celiac disease were entirely related to fertility. She could get pregnant, no problem, but staying pregnant was the issue. So if she wasn't able to absorb nutrients, neither could the babies that she was carrying. And so she had several late-term losses. I had neurological symptoms. I had seizures and headaches. And it wasn't until maybe 6 months before I got diagnosed that I ever noticed that I had an issue with my bowels. But it was really neurological for the bulk of my childhood. My son, he eats gluten and he vomits within an hour. So we all had very different symptoms that affect us and that affect us today when we are exposed to gluten. And so it can really vary. The other thing that I just want to mention and that drives me a little crazy is that oftentimes parents will say, or people in general will say, oh, I'm asymptomatic. Like if I cheat a little bit, like it's okay. Like I'm an asymptomatic celiac. And I'll say, okay, so how did you get diagnosed with celiac disease? Oh, my son was severely anemic. He, was having to get iron infusions, or my daughter wasn't growing. And well, those are symptoms. Like those are definitely symptoms. They may not be as bothersome physically on a daily basis, but those are still symptoms.
And that's, there are a few things that I want to return to in what you just said, because I think people would be really surprised by some of the symptoms and issues that are associated with celiac disease, because I think people think, oh, well, if all of a sudden I start developing a lot of diarrhea, then, oh, maybe it'll be celiac disease. But for someone to have no GI symptoms and have this unexplained challenge with fertility, like I hope that sort of puts the light bulb on for folks, particularly who are dealing with things like unexplained anemia. I mean, as dietitians, how many times do people come to see us and like, I keep trying to get my anemia under control and I'm eating iron-rich foods and I'm taking all these supplements and my iron just won't bounce back. And it's like, this is the moment where we're like, have you been tested for celiac disease? And just even asking the question with your doctor, right?
Absolutely.
Yeah. Okay. So I also want to talk about being a dietitian on the internet, the idea behind how gluten actually affects people with celiac disease and whether or not gluten causes celiac disease. Because gluten is like the internet's like favorite punching bag. So like, does gluten actually cause celiac disease? Like what's going on here?
That is an excellent question and one that Meghan and I love to answer. And actually, my favorite slide deck I've ever created was about this. So gluten plays a role in celiac disease, but it's not the only thing that causes celiac disease. So in order to get celiac disease, you have to have a secret sauce. And I'm stealing those words from Dr. Jocelyn Sylvester at Boston Children's Hospital from her amazing talk she gave at Digestive Disease Week. But you have to have this secret sauce that first starts with genetics. So you have to have the right genetic predisposition in order to develop celiac disease. So right now, the most common genes are the HLA DQ2 and DQ8 genes, though researchers are currently looking at DQ7 and other pieces of genes that could be involved in celiac disease. So there could be more than just those HLA DQ2 and DQ8. But then, of course, you have to be eating gluten. You cannot develop celiac disease if you're not eating gluten. And so that's the second piece. But 30% of the world's population carry those HLA genes. And a huge majority of them are eating gluten, but only 1% develop celiac disease. And so we know that having the genes and eating gluten aren't enough to cause celiac disease. And so it's believed that the added ingredient is our environment. And right now, we don't know exactly what it is that triggers celiac disease in these genetically predisposed individuals. But what they're looking at things like viruses, so a traumatic virus, a traumatic life experience, something in the environment around you. But there have been lots of studies showing that they don't relate to it. So things like your diet early on in life doesn't trigger celiac disease. Whether or not your mother ate gluten while breastfeeding, there's no conclusive evidence showing whether or not that would lead to the development of celiac disease. So researchers are still looking at what this magic secret ingredient is that causes the trigger. And so we still have a lot to learn.
Yeah, and just one thing I want to add there is
Yeah.
the one thing we do know is you have to be eating gluten in order to be diagnosed with celiac disease. So people who maybe they just go on a gluten-free diet and never really get that confirmed diagnosis. We don't really know. And to be honest, they probably are unnecessarily restricting something and if they don't know for sure that they have it. So we always want to be educating people about that because you need to be eating gluten in order to get tested.
I think it also really reinforces the point that a lot of us go to Dr. Google or Dr. Instagram as soon as we feel unwell. And because gluten is still such a hot topic, people might go, oh, yeah. Oh, no, absolutely. Like, I eat a lot of gluten and my symptoms appear to be related to gluten. And so they will immediately then eliminate gluten from their life, perhaps 100%, perhaps like 95%, which we can talk about why that's an issue later, without going to see their doctor and getting tested first.
Yeah, and this is sort of why researchers are looking at new ways of diagnosing celiac disease, because right now the only way to test is to be eating a gluten-filled diet and eating a substantially gluten-filled diet for a long period of time. 6 to 12 weeks is, the range that they look at. And so for people who've already gone gluten-free, the only way to get a diagnosis is to go back on gluten, which people don't really want to do, especially if they don't feel good when they eat it. And so there are new tests being developed right now that would be able to actually diagnose celiac disease with no gluten challenges. They're drawing the blood and then mixing the blood with gluten in the lab setting to see a spike in IL-2. And we're hopeful that this will, in the coming years, be a new way to actually be able to test people who've already started the gluten-free diet.
That's amazing. And I want to circle back to something because we were talking about how you need to be consuming gluten in order for celiac disease to occur. And I think that there is a portion of the population, and like maybe this is jumping ahead, but let's go here now anyways, because there is a portion of the population who perhaps does not have celiac disease, but feels that gluten seems to affect them in a negative way, or that don't have those symptoms whatsoever, but they're simply nervous about autoimmunity because of this, like sort of whatever sort of like information rabbit hole they're in. And they would say, well, let's not give my baby gluten until they're like much older, or not give it to them at all. And what do we know? And maybe we don't know a lot about this, but what do we know in terms of introducing gluten to infants or toddlers? And when is a good time to do that? And again, maybe just reinforcing, does it have an effect on celiac disease development?
I mean, there's no evidence that limiting the amount of gluten exposure severely, like not giving it at all, influences the development of celiac disease. And so I would say, until you're told otherwise, you don't want to be restricting things from your diet. But yeah, there are a lot of people who follow a gluten-free diet for other reasons. And we do have this group of people who we call them non-celiac gluten sensitive. And that's a condition where we really don't know a lot about it. There's no biomarker to diagnose it. There's no way to test for it other than trying gluten and assessing symptoms. They don't know how many people actually have non-celiac gluten sensitivity because we don't have a good diagnostic criteria at this point. So I think it's possible that there's people who might have something else going on. And the first thing that comes to mind is IBS, or irritable bowel syndrome. IBS is a functional disorder of the gut, and a lot of the symptoms look like the digestive symptoms that somebody with celiac disease might have. So abdominal pain, diarrhea, and constipation, those are two things that are really common in celiac patients. The thing with IBS, though, is that FODMAPs, which is a specific type of carbohydrate group, is actually the most common dietary trigger for symptoms in IBS. And wheat, barley, and rye, which are the gluten-containing grains, happen to also be very high in FODMAPs. And so a lot of times there's some confusion there. Like if you're just going gluten-free, are you feeling better because of the gluten, or are you feeling better because you reduced FODMAPs in your diet? And the gluten-free diet is not the same thing as the low FODMAP diet. There are a lot of food products out there they're high FODMAP, but they're gluten free. So it's not exactly the same thing. But I think if you're not really educated about what's in your food, you might feel better because you cut out fruit cans. And so, it's hard to say. As far as autoimmune diseases as well, there's no evidence that going on a gluten free diet is a treatment for any other autoimmune disease besides celiac disease. So, if that's kind of a myth that we see a lot online, that it's a treatment for other autoimmune diseases, but there's no evidence for that.
Yeah. And thank you for clarifying that. And there's a couple of things that I want to point out there. I mean, the first is the whole sort of internet autoimmune disease, gut barrier dysfunction, celiac disease versus non, because there could be some people with undiagnosed celiac disease who also have another autoimmune condition. And so if you take out gluten, you feel better. But if you didn't get tested for celiac disease, like you don't know, like, 5 years later, you try and put it back, and then like all hell breaks loose. But what do we know about, because this is a really common idea on the internet, that because gluten in celiac disease, which is an autoimmune disease, causes gut barrier dysfunction, aka some practitioners will say that gluten causes gut barrier dysfunction for everybody. Can you speak to that a little bit?
Yeah, I mean, you know, I think there's not enough evidence to say that at this point. There's been a few studies years ago at this point, and no one's ever been able to show that since, at least to my knowledge. One quote, I will quote Dr. Ben Lebwell from Columbia, because we were talking about this once, and he said, if you feel better following a gluten-free diet, I'm happy for you, but we want to make sure you really need to be following it, and we need to make sure that you are getting the right balance of nutrients in your diet. So I think to that end, possibly those people, maybe they're gluten intolerant as well. We don't really know it, and it's just kind of figuring out something that works. So as a dietitian, I try to kind of ease those concepts in a little bit. We can play around with changing the grains in your diet, maybe, without necessarily going all in on gluten free, because we don't want people restricting food groups entirely if they don't have to be.
Absolutely.
Celiac disease and the gluten-free diet are extremely limiting. And it's not just, the food that you eat every day, the social, emotional things that go along with being on a special diet can be crippling to people. And, especially to kids who want to, participate in school normally, go to summer camp, travel the world. It's very limiting. And so I think that it's so important for people to get the right diagnosis so they don't unnecessarily have to restrict themselves on their lifestyles.
Yeah, and I think that's so important that we acknowledge that as well, because I do think that some practitioners and influencers on the internet, they're so cavalier about food restrictions and elimination style diets, whether it's one sort of like nutrient or component like gluten or across the board, forgetting that food plays such a central role in our lives, like not just as fuel, but as in travel and as connection with our community and our families and our celebrations. And it's treated so lightly, but it's actually not something to be taken lightly.
I was on the celiac cruise last week. The Celiac Disease Foundation does all the education on board celiac cruise. And at one of our sessions we were doing with families, a mom was telling the story of how her daughter had no relationship with her grandparents because she's too worried to let her daughter spend time with them in their home, even because they're so worried about her being exposed to gluten. And so, years after her diagnosis, she spends limited time with her family because they're so worried about exposure. And I sat there, fighting back tears, listening to the story that this disease limits somebody so much that her daughter could not, have the same relationship with her grandmother that my kids have with their grandparents, that I had with my grandparents, because of the way that they have to eat. And so I think it's really important that when you're considering making a choice like becoming gluten-free, that it's for the right reason, that you actually really need to be on that diet, and that you're working with a skilled dietitian, with a skilled, gastroenterologist, to make sure you're doing it in a way that isn't going to hurt you emotionally.
Yeah, thank you for that. I hope that people listening to this will say and hear, yes, sometimes if you just feel better not eating gluten, okay, like explore that. But before you explore that, it is go and get that diagnosis, get screened for celiac disease, really talk to your physician if it's not celiac disease, because maybe it's IBS, because that feels similar in some ways, but it is a separate sort of dietary pathway that you're going to explore. And once you've done all of that, then perhaps you can say, well, maybe let me just try being gluten-free. And maybe you're going to avoid the largest sources of gluten versus, the small sort of like cross-contamination sources, but only once you've been through that diagnostic process.
Yeah, and I would also encourage you not to forego the biopsy unless you have a really good reason to. Just in the last month, we've seen a number of patients who had positive TTG antibody tests that, we were like, okay, biopsy is just confirming like they definitely probably have celiac disease. And then they had the biopsy and it turned out they were positive for EOE. So they actually got eosinophilic esophagitis diagnosis after the biopsy and not celiac disease. And so, I think that we're still in North America, not at a place where we're foregoing the biopsy, and for many people, for really good reason why.
Yeah, thank you for that. Let's return back to celiac disease and talk a little bit about, because we started to talk about what an impact it has on your life at the top. But what are some of the nutritional related issues we see? So, like things like nutrient deficiencies, et cetera.
Yeah, I mean, nutrient deficiencies can cause a lot of other issues. So, anemia is one where you're going to have lower energy levels, poor oxygen blood in your blood, which then has reduced oxygen to the rest of your body. Bone mineral density issues are a big one. A lot of people with celiac disease develop osteoporosis, and that's all related to nutrient deficiencies. So when the villi are damaged in the small intestine, you are not able to absorb the nutrients from your food. And so there can be a lot of red flags, I guess, when it comes to diagnosis, because when you see the dietitian, the first thing they're going to look for is what your nutrient status is. And typically the main ones they're going to look for are things like calcium and vitamin D, iron, B12, probably folic acid and zinc as well. And it's really important that you get tested for those things, because the intervention is going to be a combination of including foods that contain those nutrients in your diet, and oftentimes supplementation, but targeted supplementation, so that you make sure you're getting what you need and not too much of things you don't need. So absolutely important to work with a dietitian through that, because the nutrient deficiencies can lead to long-term complications.
And in terms of like GI symptoms, because I think, and I've spoken to a lot of people who had this idea that once they adopted a gluten-free diet, like everything should just get better. But for a lot of people, there's a lot of GI uniqueness, let's say, still with celiac disease. Can we talk a little bit about that?
Yeah, I mean,
Yeah.
people with celiac disease are at a slightly increased risk for developing other conditions that are affecting the digestive tract. So IBS is one of them. With IBS, actually, it's estimated that people with celiac disease are 2 times higher risk to develop IBS, which has a lot of those unpleasant GI symptoms. And it becomes really difficult because, is it gluten that's causing your symptoms, or is it the IBS, the FODMAPs, or other triggers for IBS? And so it can be a little bit hard. I think the challenges for patients is that you aren't really sure if you're being exposed to gluten. And that is, again, where a dietitian can really help you figure out, okay, are you being exposed to gluten and you maybe aren't aware of it? Or is this really something that you can manage in a different way, a different type of dietary intervention besides the gluten-free diet? So yeah, it absolutely happens. We see this all the time. And it's tough because people are really afraid of being exposed to gluten, but it's possible that it's something entirely unrelated.
And I think we also have to mention anxiety, that the anxiety that people feel around being exposed to gluten can cause them stomach issues. Just the stress, that fight or flight response can definitely lead to ongoing issues. And I think that unfortunately, some people, when they're diagnosed with celiac disease, they become extremely fearful of gluten in all aspects of their life. And so there are a number of celiac centers now that are involving mental health care into the celiac clinics with social workers and GI psychologists. And I just think it's something that's so important. And I wish that everybody who was diagnosed had access to.
And I really think it speaks again to that sort of mental load of what it is to have a chronic autoimmune disease that is treated by diet, and a diet that is so incredibly strict. This isn't just like, let's balance our blood sugars or let's reduce our saturated fats. Like, this is extremely strict elimination of gluten, which I would like to speak to now, because something I've noticed in the last few years, there has been, at least in my area, unfortunately, a little bit more of a GP blood test, you got celiac disease, go be gluten-free pipeline. And people are out in the world thinking they're gluten-free. And I will look through their dietary records. It's like, well, there's soy sauce there. Do you realize? No, like, there's a lot of misunderstanding, like that the big gluten is gone. You've got
Yeah.
gluten-free bread and gluten-free tortillas and gluten, but a misunderstanding that it's all forms of gluten, but also cross-contamination. So can we talk a little bit about that?
Yeah, and it's a huge problem, and we're working very hard to educate primary care providers on the importance of referral to celiac specialists, or if people are not up for the referral to go to a GI because they're convinced of it, to at least get that referral made to a dietitian so that they get the right education. Cross contact is huge with celiac disease. Of course, we don't want there to be gluten contaminating the food that is supposed to be gluten free. But we run a fine line because you want to be vigilant, but you don't want to become hyper vigilant. And that's unfortunately where a lot of people get to. And so for decades, there have been recommendations that you have to, get rid of everything. You can't use pots and pans or cutting boards or colanders. You have to throw everything away. But what we know now is that's really not the case, that washing works. So we like to think about it in the same way we think about raw chicken. So if you had raw chicken on a cutting board or in a bowl or in a pan, and you've washed whatever that equipment is well enough that you would now prepare a salad in that same space, you've washed it well enough to remove gluten from whatever the appliance is. And there have now been several studies done confirming that washing works, including one that we're presenting at the beginning of September at the International Celiac Disease Symposium, where we looked at shared pots and pans for boiling gluten-free and gluten-containing pasta. We looked at cutting boards, colanders, and shared toasters. And what we found is that when you've washed the equipment before putting gluten-free into it, there is no risk. We had 0 samples that had any gluten residue on them after washing. And our standard for washing was singing happy birthday while using hot soapy water. It was a really fun study to do. We had gastroenterologists from major pediatric celiac centers in the kitchen cooking and washing. And so it was really fun to see it happen. With the toasters, we tested pop-up toasters and toaster ovens, and we tested shelf-stable and frozen bread, toasted gluten-containing bread, and immediately following gluten-free. And again, there was no cross-contamination detected, period. All of them, there was no gluten detected. So our recommendation is that shared kitchens with proper hygiene that you would, use to prevent bacteria, the same rules applies for gluten, and that you can safely have a shared kitchen. Despite that, some people just might not be comfortable, and it's okay to have separate everything. But if you are going to grandma's house, like when we go to visit my in-laws, their house is not gluten-free. 5 years ago, I never would have dreamed of putting my gluten-free bagel in their toaster. but now I do. And let me tell you, that toasted gluten-free bagel is a whole lot better than the untoasted gluten-free bagel.
That's so helpful. And it's incredible to see that the research is still ongoing, because the more that this, even something like that, it makes things so much easier, and it does allow you to relax a little bit,
Yep.
because you're like, okay, great. Like, we don't need to keep everything separate. That's fantastic.
I will qualify that we tested these with home toasters, not in commercial settings. And so I would not recommend being in a hotel where there's like a rolling toaster and it falls into the crumbs. Do not do that. At home, though, we have tested it extensively.
I think that we should talk a little bit about all of the things that are thrown at people with regards to gluten. You're like, oh, your celiac disease, here's this gluten enzyme on the market, because supplements are always such a huge, particularly in gut health, supplements are such a huge part of what people are told to try. And there are these gluten enzymes like glutenases on the market. Can we talk a little bit about glutenases in general?
Yeah, there is no evidence that those can be helpful for a celiac patient. It's just hands down. I think there are researchers like rigorously looking at if this is possible. And at this point, all of those products on the market are not breaking down gluten for, and you know, I think it's a problem with supplements in general is they're not very well regulated. And so people can make claims that aren't necessarily true. So while, that supplement might make somebody think that they feel better, it doesn't mean that it's helping, and they are not recommended or safe for people with celiac disease.
So definitely people with celiac disease, steer clear of the glutenases. But what about other supplements? Like, because there is the potential for nutrient deficiencies, because there is the potential for more IBS-like symptoms, what are some of the basic supplements that are typically recommended? Of course, always being individualized, ideally with your dietitian. But what are some of our basic recommendations?
I mean, this really depends on the patient. And I think anybody who just broadly recommends a supplement without looking at what is going on with that patient is not being responsible. Very often a newly diagnosed person with celiac disease is going to have nutrient deficiencies. And so you're going to want to look at the diet and look at their blood work to make a determination about the appropriateness of a supplement. A lot of times, vitamin D is on that list. Always want to make that decision based on blood work, but a lot of people are deficient, and this is absolutely a concern in people with celiac disease because of the villus atrophy and potentially fat malabsorption that people are experiencing before they get diagnosed. So that might be one. Calcium's another one. I mean, this is going to depend a little bit on dietary intake and if the diet is adequate in calcium, but sometimes a calcium supplement is recommended. And I think this is, calcium supplementation is a little bit tricky. You don't just want to take one calcium supplement large dose at one time. That's not actually going to help you replenish your nutrient stores. And so this is why you need to be working with a doctor or a dietitian who knows about this, because you can only absorb 500 milligrams or so at a time, and you need to spread it out throughout the day in order to really absorb the calcium. So there's a lot that goes into it. Some of the other ones, it really does depend on what is going on with that person. Of course, there are fiber supplements for people who have constipation or diarrhea, and that is all on an individual basis. I think the other one I see is probiotics. There's no evidence to suggest that probiotics are helpful for treating the symptoms of celiac disease at this point, but there are reasons people take probiotics that aren't necessarily associated with celiac disease. So it really does depend. The one thing I'll say is to always make sure that your supplements don't have any gluten-containing ingredients, because again, these things are not really regulated. And so you always want to be reading the labels of something that you're taking.
That makes me think of things like chapsticks and lipsticks and cosmetics and gluten. I know it's a little bit controversial. Can we talk about it?
Yeah. So there's been one study done on this, and The basic gist is that it's very low risk. We know that you cannot absorb gluten through your skin, that the protein is too large to be absorbed. And so that it doesn't matter for lotions and hand creams or shampoos, those types of things, unless you risk eating it. So we'll think about it for, like young children who might be in a bath and, they open their mouth in the bath, the shampoo or whatever gets in their mouth. Then we don't want you eating shampoo, obviously. But for things like lip gloss and lipstick, where it's on your lips, you lick your lips, you bite food, when there's a risk of ingestion, that's the only times where we really want to make sure that it's a product that's gluten-free. But, we shouldn't be eating sunscreen. We shouldn't be eating lotion. We shouldn't be eating these things. And you can't absorb it through your skin.
Thank you for putting that one to rest. I mean, with children, all bets are off. They will eat everything we're not supposed to eat. But for the rest of us, that's awesome. And, this is probably then the good point, because I think that once people have sort of got this idea of how to be strictly gluten-free, they know how to read the labels, they're really, communicating anytime they're eating outside of the home. But they probably still have a lot of questions, and maybe they do or do not have access to like an awesome GI or an awesome dietitian. Like, where can people go for trustworthy information so that they're not just going on Instagram and letting the influencers do the talking?
Sure. So I'm going to start by saying where they shouldn't go. And so when I spent 17 years working in pediatric hospitals between Boston Children's and Children's National. And something that drove me crazy was when I would see on Facebook, in these like crazy Facebook groups, our patients, the parents posting questions about things and getting hundreds of wrong responses to them. And I was like, why didn't you just send me a message in the portal? But of course I can't message them, right? But so there are these Facebook groups out there that are humongous with tens of thousands of members in them. And because people want instant responses, they'll go and they'll post their questions. And a lot of the times the responses that they're getting are flat out wrong. And it's really scary that then people take that information as, the holy grail and, can really put themselves or their child in harm's way. So I would say, first and foremost, you should go to a trusted source. I would advocate for the Celiac Disease Foundation website, where we have infinite numbers of resources. We also have very active social media accounts where people are constantly posting questions, and we do respond to them. Meghan and I monitor every single comment that comes in. Meghan does an Ask the Dietitian column where she answers nutrition questions. We have an Ask the Chef column where I respond to food-related questions. And so we really do answer questions that come into us. And so I would advocate going to a reliable source, whether it's us, whether it's messaging your dietitian or doctor through your patient portal. Go to somebody who can actually give you truthful information, because the things that we see in these groups are, Meghan and I are just constantly rolling our eyes.
Yeah. Facebook group is good for, what's your favorite type of gluten-free bread and what stores
Yes.
can you find it at? Not good for asking health or nutrition information.
People will post like images of their kids' lab results, and probably at least once a week, I'll see somebody post their celiac panel where the TTG is completely negative, but the total serum IgA is positive. And they'll post it in the group and say like, oh, can anyone help me interpret this? And you'll have like 1,000 people like, oh my gosh, your kid has celiac disease. And we're like, no, that's a negative test. They don't have celiac disease. You actually want that total serum IgA to be positive, or else the TTG level could be inaccurate. And so people just see a positive reading and don't understand what it means. And so, let your doctor interpret your test results, not a Facebook group.
Yeah, they go to school for over a decade for a reason.
Yes. Or also another common one I see is people are like obsessed with the TTG number. And so, they'll say, my kid went for their annual follow-up. We've been strictly gluten-free for 8 years. Last year, the test result, like, okay, the scale is 0 to 20, right, is within the range of normal. And they'll say, last year it was 17 and this year it's 18. And they're freaking out that they have to change everything about how they're handling it because it went up 1 point, yet it's still within the normal range. And so, don't let Facebook weigh in on those things. Let your doctor or dietitian help you understand it.
It is so important. It's why you put a care team around you who can interpret this advice and give you tailored information about what you need to do based on what your blood work is looking like. Let's talk a little bit about the work you both do at the Celiac Disease Foundation. I'm going to make sure that I share links so that people can access all of your incredible resources. But what does the Celiac Disease Foundation do besides run things like socials and like Ask the Dietitian?
We do lots of things.
Yeah.
So education is a huge part of what we do, both patient and family education, but also health provider education. And so we run regular CME and CEU programs for all health providers to make sure that celiac disease stays part of their continuing education. And we offer it all for free. So you can get your CEU credits for the year by coming to our programming. We do support programs for patients and families. We do a getting started. So it's called Living with Celiac, meant for newly diagnosed patients to come and ask panel of experts their burning questions so that every month you can come and ask whatever you want and get real answers. We do a teen talk, which is specifically for teenagers living with celiac to come and connect with one another and be in a safe place to talk about living with celiac disease and get support from peers. We have a culinary medicine program where we bring together doctors, dietitians, and chefs to teach about the latest research, nutritional updates, and cooking classes. We have a food insecurity program. We do enrollment in clinical trials. Meghan, what am I missing? There's so many things.
I think you got the big ones.
Well, and you also wanted to talk about clinical trial recruitment, didn't you?
Yeah. Do you want me to take this? Do you want to do it?
Yeah, you can take it.
Okay. So actually, I worked in pediatric hospitals for 17 years before coming to the Celiac Disease Foundation. And when I started here, what I was the most surprised to learn was how involved CDF is in clinical trials for celiac disease. And it's actually made me really inspired of promoting the trials, knowing how much of a role the organization plays in developing them. And so CDF doesn't just push emails out telling patients, you should enroll. We don't just get paid to push emails. We truly are involved from the ground up with the companies, really developing the trials, developing the materials, helping them put together these programs that are going to resonate with our community. And seeing how much care goes into developing them has really, it's warmed my heart for why people should participate in clinical trials. And it's been awesome to see patients giving back to the community, because we will never have a drug for celiac disease if patients don't step up and enroll in these trials. And so I would encourage all the dietitians and health providers listening to look into the trials that are available. It's celiac.org/trials, and help your patients see whether or not they qualify, because having a drug as an adjunct therapy to the gluten-free diet would be a game changer. That, my son and I could go to a restaurant and not worry if there's cross-contamination that happens, or potentially, immune tolerance and be able to eat gluten again. But we won't get there without people participating. And so I think it's super important for the community as well as health providers to learn about them so that you can steer patients to ones that they might qualify for and might work well for them.
Yeah, I think
And
for
Vanessa
people,
and I had a really cool experience recently on the celiac cruise, where somebody who heard about the trials on the cruise from one of Vanessa's presentations actually joined one and participated. And we posted recently about what her experience was like. And so I definitely encourage you guys to check out our breaking news where we share that patient story, because if there's a way to encourage people, I always think it's hearing others.
yeah, and for people in the community to know that they can contribute not only to their future with celiac disease, but future generations with celiac disease is so incredible. And for all of the dietitians to be able to say, hey, you know, these clinical trials exist, and maybe maybe this would be something you'd think about. I want to, before we go into the rapid fire questions, talk a little bit about, for someone who is listening to this who has had celiac disease for a while, they're like, I've got gluten-free down pat, but I really want to do whatever I can to take care of like my overall health and nutrition so that I feel my best now, so that I'm energized now, so that my chronic disease risk later on is reduced. Like, what kind of nutrition, advice would you give to that person?
So, generally speaking, the same nutrition guidelines apply once you're on a gluten free diet. You're still looking to follow all those same types of guidelines. So, a Mediterranean style diet is associated with reduced risk of almost every chronic disease. And so, that can be a part of a gluten free Mediterranean style diet is possible. So, I would say eat more plants, eat your fruits and vegetables and all those wonderful nuts and seeds and beans and legumes that us dietitians love. You know, generally speaking, adding more plants to your diet is a wonderful thing, and leaning into the idea that you're going to get the majority of your nutrients from food rather than relying on supplements is where I like to tell people to start.
Yeah, I do like that too, because I think initially there's such a focus on gluten-free packaged foods for everything and finding those things. And those things are absolutely part of an enjoyable and nutrient-dense diet, but remembering that fruits, vegetables, non-contaminated nuts and seeds, like all of those things are naturally gluten-free and part of the gluten-free diet as well. I love that. Okay. Let's shift into the rapid fire questions. They're just 5 like little softball, getting to know you both. So the first one is really because I'm so nosy and I'm always curious. Do you have any hidden talents or unusual skills? Meghan, we'll start with you.
My gosh, that's a hard one. Unusual talents. I remember everybody's birthday. I am very good at remembering that. And so, yes, it's once I learn it, it's pretty much in my brain.
That's incredible. Okay, Vanessa, what about you?
I'm obsessed with soccer and I coach both my kids' soccer teams. And it's like my favorite part of being a mom.
We are a big soccer house. I absolutely do not coach. So my hat is off to you because the coaches are everything. Okay, favorite gluten-free grain? Vanessa, you go.
Oh, buckwheat. So I love buckwheat for lots of reasons. One, it's like super confusing because it has the word wheat in it, but it has nothing to do with wheat at all. It's actually related to the rhubarb plant, but it's a really cool grain that is actually used to make gluten-free beer. And so it's just like a cool grain that you can cook with, you can roast it, or you can make beer out of it.
Love that. What
Yeah.
about you, Meghan?
I'm a big quinoa fan. I know that's not technically a grain, right? It's a pseudo cereal or whatever, but it is, it's so high in protein, so high in fiber, and it goes well with everything. And I love that it takes on the flavor of whatever you're using.
I love that. I feel like quinoa is like coming back around. Like it was all about quinoa for a while and that sort of quietened down, but I feel like it's quinoa's time to shine again. But I love buckwheat too. Okay. You have 20 minutes all to yourself. You are not allowed to be productive at home. You're not allowed to be productive at work. What do you do? Meghan?
I grab my book. I'm a big reader. My Goodreads want to read list is very long, and I need more time in my day to actually make that happen. So I would just sit in a quiet room with my Kindle, and I would just, yeah, sit there quietly and read.
Kevin, what are you
So
reading
this
right now?
Right now, so I am really into the Cormoran Strike series, which is J.K. Rowling is actually writing under a different name, Robert Galbraith, and I just really love a mystery, and all the mysteries are different. They're not all murder. There's some mix of crimes in there, so I'm really loving it.
Vanessa, what about you?
Okay, so my kids and I are like obsessed with Mount Everest. We are like gung ho that like someday we're going to go to Mount Everest. We're not like necessarily going to climb Mount Everest, but like go to base camp. And so like when our like guilty pleasure right now is sitting around and watching videos of all of the like experienced climbers who have climbed. We've watched every movie on like Netflix and Amazon Prime about climbing Mount Everest. And so even in our basement, my kids have like used chalk on the walls to like draw the different camps. And so like planning a trek to Mount Everest.
Oh, I love that. That's so awesome. Okay. Sweet or savory? You can only pick one. Vanessa, you go.
Savory.
Me too.
Me too, I think.
Perfect. Across the board. Easy. So we're all going to be duking it out at the cocktail table next time we see each other. Okay. And then your go-to gluten-free snack, Meghan.
Okay. I really love like an almond butter banana situation. That is my go-to snack every day, pretty much. It's like one of my favorites. It balances savory and sweet. So we love that. And yeah, I have it almost every day.
Amazing.
I mean,
Vanessa?
Cucumbers and hummus. Like, I love hummus. Homemade hummus is even better with cucumbers.
Yeah, I love it. Hummus is like a food group in this house
Yes.
on its own. Oh, Vanessa and Meghan, thank you so much for sharing your knowledge and also more about what the Celiac Disease Foundation does. I know that whether folks are like newly diagnosed or, they're already on their path, there are a lot of little nuggets in here that will really help people sort of check in with themselves and their nutrition, or if they're uncertain, to like hopefully run straight to their doctor to get a proper diagnostic workup before they do anything else.
Thank you so much for having us.
Yeah, it was a pleasure to see you, Desiree.
Yeah, you too.